All of that is considered gatekeeping, and that is not allowed according to WPATH. What he is saying there is that to give these kids, these young kids, medication that's going to essentially seriously impact their sexual functioning and their reproductive functioning, they're not really capable of giving informed consent. But he says, we have to keep the kids happy in the moment. And they're completely aware that the evidence behind it is so poor. And so what the reality is that these are experimental surgeries, especially on minors. This is like one of the final nails in the coffin of WPATH and in the coffin of gender-affirming care.
Hi, welcome back to the Partners for Ethical Care podcast, Journey Through and Out of Gender. It's been an incredible week here in the world of gender identity because finally the WPATH files have been released. These files are some of the most disturbing things we've ever had the chance to read. For years now, we've been saying, listen, this stuff is incredibly unethical. These patients are being, hurt essentially and not helped by these treatments. We've been screaming it from the rooftops that children cannot consent to having puberty blockers and cross-sex hormones. And it appears that WPATH, the world authority on transgender medicine, have also had their fears and suspicions. This entire saga has been reminiscent of a lot of other bad medical scandals that have occurred over the last 100 years. First of all, we had the lobotomy scandal, right? Whereby people were lobotomizing women for hysteria or for being very sexually active or for having a little bit of depression. And now we look back on that and we think to ourselves, wow, what barbaric times. How foolish could people have possibly been, right? We say to ourselves, no, this really could never happen again. This could never happen again. And then what happens in the 90s? We have the opioid crisis, right? For the best part of 15 years, the pharmaceutical industry was telling people in their pamphlets and in their leaflets that opioids were not addictive and that you could give these drugs to people who had relatively minor injuries, toothache, small back problems. And you have basically, 10 years, 15 years of people being addicted and their lives being ruined essentially by addiction to opioids. And now the 21st century has its very own, saga of the lobotomy, and that certainly is the WPATH files. So in this episode, we're going to explore, together with Dr. Miriam Grossman, MD, a little bit further about what these files actually contain, what the ramifications are. How could this really have happened, right? How could a body that is supposed to be the world experts in this type of medicine not only have got it so wrong and continued to get it wrong, but now you say to yourselves, okay, well, what about these victims? How are we really going to get justice for all of these people who have been hurt by these really barbaric practices? Some of the things that came out in the WPATH files were shocking, right? We had admissions that many of the doctors feared that the kids really couldn't understand the ramifications of taking these particular drugs. One of the most shocking things that came out of this entire WPATH scandal saga was that the doctors freely admitted that they didn't believe that their patients, their young patients, were able to understand the ramifications of taking interventions like this. It's very sad to be reading these files. It doesn't feel good to read these files, but it's very important that we understand what happened here. It's very important that we understand so that we can learn from this catastrophe and also so that we can start to correct the culture, so that we can start to really get back on the right path. And thank you very much. And let's hear it from Miriam Grossman herself. So everybody knows this week the explosives WPATH files were handed into our laps. So I'm incredibly excited today to be joined by Dr. Miriam Grossman, MD, to discuss the latest developments and to get her, expert opinion on all of this. So thanks very much for joining us today, Miriam.
It's great to be with you, Alex. I'm so glad to see you once again.
Yeah, it's fantastic. So Miriam, maybe before we get into the explosive WPATH files, could you give us a little bit of background on who you are and how you kind of got into this?
Sure. I'm a child and adolescent and adult psychiatrist for a long, long time, for about 40 years now. And I became aware of, let's call it, gender ideology or gender belief system, because it really is there. It's not medical. It's not scientific. This idea that people can be born in the wrong body, this idea that we have an identity that's completely disembodied from the physical reality of our bodies. I became aware of it quite a while ago, about 15 years ago. And I was immediately very alarmed to see that kids were being told that they can have an identity as boys or girls completely separate from their bodies, and that this was a normal variation of development. So I ended up in one of my books that I wrote about sex education called You're Teaching My Child What? I included a chapter about gender. And Alex, that was all the way back in 2009. This is really like 15 years ago, that I became aware that kids and really small children were being exposed to this bizarre idea, this idea of being disembodied, because that's really what we're talking about here. It means that your mind is just completely rejects your physical reality of your body. So that's disembodiment, and that is not healthy. Mm-hmm. We do not want that for our children. We don't want it for anyone. So anyway, I guess I'm answering in a very long way your short question, but I became aware of this issue. I started writing about it. I started warning parents about it. And unfortunately, at the time, it was really only picked up by what many people would call the extreme religious right. They recognized the danger. But elsewhere, it was not picked up. It was not recognized. It was ignored. And so, sadly, we have the situation that we're in right now, which is that in the past 10 years, the numbers of young people who suddenly, out of the blue, are claiming a so-called transgender identity or non-binary, whatever that means, identity, has gone up in the Western world 5,000%.
Wow. Yeah, it's that's completely and utterly shocking. I mean, even after years of talking about this, the numbers never fail to shock me. To be honest, if you would have said five times, or when people start saying these kind of 5,000, it's almost unimaginable to me, and I'm sure it must really offend you as a scientist. You're a person of science. Incredible. So tell us, Miriam, what exactly is WPATH for the layman who's just kind of walking into this?
Sure. Well, before saying that, I'm just going to take one moment. I hope you don't mind. Mm-hmm. I just want to remind your audience that sex is established at conception. Mm-hmm. Okay, so before we get into this whole discussion that we're going to be having now about WPATH and other things, other research that's come out recently, mm-hmm. I just, we tend maybe to forget, since we're hearing so much of the opposite, people might forget that male or female, only two choices here. It's so important, Alex, for all of us to remember, because we're hearing the opposite in our culture everywhere, that humanity is divided into male or female. And that is science. That is, the science is being spinned right now so that we are led to believe that male and female are just two among many, many different options. That is not correct. From conception, from the moment that the sperm and the egg unite, you have a new life that is either male or female. That is permanent, that cannot be changed. Of course, you can take medications and you can undergo different surgeries so that your appearance can be altered. And it can be altered in a very convincing manner, as you and I know. But bottom line is, a male cannot become female, a female cannot become male. So I just wanted to sort of get that out.
Mary, I mean, it sounds like such a basic thing, right? But we know nowadays that we do need to say these things over and over and over again. Yeah, that there's only two sexes, and that that nobody can change their sex. It's really kind of when a male becomes a female, this is really a linguistic achievement or an achievement of plastic surgery. Right? Or, cosmetic surgery. That's so important for us to remember here, exactly what Dr. Grossman is saying. So
I was going to say it's especially important for those young people who have been led to believe that they can change their sex, to know that. To know that is a delusion for them to believe that they can change their sex. Okay. So WPATH.
But I suppose actually, Miriam, if I could just say, I suppose that really is such the betrayal of the story, if we're talking realistically here, because when I go to my doctor and I request even, Beecham's flu medication, I really, you're entering into a trust scenario. You're trusting the doctor, and you're trusting that they actually know what they're talking about. And I feel that as a young person, to be lied to is something as basic as your sex, or that it's possible to change sex, or that you can be non-binary. It's such a deep betrayal of these young people, and I think that's really what has come out, I suppose, in the WPATH files, right?
Correct. That is the perfect segue into our discussion of the WPATH files. The fact that these young people and their parents are putting their full trust into professionals. Yeah. Now, WPATH stands for the World Professional Association for Transgender Health. And of course, this sounds like a very, reputable, impressive organization. And at one time, Alex, about 25 years ago, it was a bona fide medical professional organization. But that changed because what it is, and what we know now beyond a doubt, it's not as if we didn't know this before the WPATH files. A lot of us, yourself, Genevieve Gluck, Karadansky, and I also wrote about it in my book that came out last year, Lost in Transnation. Many of us,
which is right behind me.
Yeah.
Excellent book. We at Partners for Ethical Care thoroughly recommend it, but we'll plug that right at the end. Okay. Yeah. So exactly, you're so right. So many people wrote about it, and so go ahead. Give us the history of this group.
Yeah, so many people were aware that this group, as of 25 years ago, was no longer a medical organization. It is run by activists who believe in so-called affirmation. I hate using the language of the other side because these are Orwellian terms. So, and I also hate always having to do my air quotation marks. So, what's become clear is that WPATH is run by activists whose goal is affirmation at all costs. Mm-hmm. So what that means is no matter your age, no matter what mental health issues the patient may be grappling with, medical interventions, hormones, and surgeries should basically never be withheld. Even if we're talking about a young child who, who's 10, 11 years old, on the cusp of entering puberty, and the doctors are going to give the child blockers so that this natural, organic process of puberty, which is necessary, every human being has to go through puberty in order to become an adult, but the doctors are going to block that process and then continue with cross-sex hormones, which is going to sterilize the child. So they believe that you still need to go ahead with this if the child wants it. And so it's affirmation at all costs. No gatekeeping. Gatekeeping meaning, of course, when doctors, therapists are going to, when you're facing a medical procedure that's going to be have lifelong repercussions that may be irreversible, you're going to proceed with caution. Mm-hmm. Okay, but to WPATH, proceeding with caution, asking questions, moving the process very, very slowly, doing an exhaustive mental health evaluation, and then giving the person the mental health treatment and support that they need. All of that is considered gatekeeping, mm-hmm. and that is not allowed, mm-hmm. according to WPATH. So the way that they frame it, and this has been going on a long time now, is that they frame it in the context of civil rights.
Civil rights.
People have a civil right to access to these medical and surgical interventions without any gatekeeping, and to any obstacle that is placed in the way of these individuals, again, no matter their age and no matter their mental health status, is a violation of their civil rights.
It's pretty incredible to think about, because surely if I go into my doctor today and I say, I think I would like to have, something like triple H breasts or whatever, my doctor would surely gatekeep me and say, hi, I'm not convinced. Why do you want to have this? Let's do an exhaustive mental health analysis, because this is big stuff you're talking about here, right? I don't think that. So am I making a false equivalency, or are we on that kind of path there?
No, of course, any reputable surgeon, and I'm not saying every surgeon is reputable, some just, are looking at their bank accounts, but any reputable surgeon, we're talking about plastic surgery here, right? Elective surgeries, mm-hmm. is going to thoroughly, if they suspect any sort of mental health issue or other condition that may be at play here with a patient who walks in and demands certain treatments or procedures, is going to take some time and say, well, let's talk about this. Surgeons aren't always the best at talking. They'd rather use a scalpel. But they really are ethically obligated to see whether there are some mental health issues going on. Mm-hmm. And Alex, as you know, and as probably your audience is well aware, that the vast majority of these young people that are coming forward now and insist that they have a new identity, right. A new gender identity, as it's called, have very significant mental health issues.
Mm-hmm.
But WPATH is saying that those issues are irrelevant.
Right. It's
They're
not part
saying
of the conversation, almost, right?
be part of the conversation. They're even saying that a person could be acutely suicidal or psychotic. Psychotic means, not living in reality.
Mm-hmm.
They might be hearing voices. They might have delusions or who knows what. I've taken care of
Right.
seriously mentally ill psychotic individuals, and they can believe all sorts of things.
Absolutely.
And WPATH has said for quite a while now that none of that should be an obstacle to getting these treatments. So basically what you have in these WPATH files that were released recently are conversations and a video from internal WPATH discussion boards, I guess it was, where, the members of WPATH are getting together and they're just, like on any discussion board, they're saying, hey, I noticed this issue in one of my patients and I'm concerned about that issue. And, what are you guys doing under these circumstances? What are your thoughts about A, B, and C?
Mm-hmm.
And that's what we now have available to us.
I just wanted to piggyback on all of the importance that comes up with the informed consent issues. I often see people who, because there's such a backlog of therapists to do some of the mental health therapeutic support, I often see people who have already engaged in some sort of, and this is again with youth, who've already engaged in some sort of medical intervention. And so one of the things I do is I'm sitting with the youth and their parents and I say, oh, well, so tell me more about what you know about that medical intervention. And kind of like what Dan was saying, children and young adolescents, we wouldn't really expect them. It's kind of it's out of their developmental range sometimes to understand the extent to which some of these medical interventions are impacting them.
We do it. We try to talk about it, but most of the kids are nowhere in any kind of a brain space to really, really, really talk about it in a serious way. That's always bothered me, but we still want the kids to be happier in the moment, right?
And I appreciate that much less with a 9, 10, or 11-year-old who's starting puberty suppression. And like Ren said, if they continue on, then and I mean it's like developmentally not in their space to be able to have to think about that, and it shouldn't be, right? And so I think it is a real growing edge in our field to kind of figure out how we can approach that. I'm definitely a little stumped on it.
It's really quite shocking. Again, a lot of us were aware of these conversations. We were aware, for example, I put it in my book, I put in a transcript of Dr. Daniel Metzger, who is a Canadian endocrinologist, and he is very clearly voicing his concerns about a number of things. What he is saying there is that to give these kids, these young kids, medication that's going to essentially seriously impact their sexual functioning and their reproductive functioning. And what I mean by that is their ability to be sexually aroused, to be stimulated, to reach sexual climax, and to have biological children. So he's aware that all those options for any normal human, that any normal person would want to keep those options open for themselves as an adult, that these treatments are going to impact, if not eliminate, those those very important human functions.
Mm-hmm.
And he's voicing his concern, and he's saying, you know, when I sit down with a 14-year-old and I talk to them about having kids, they're in no headspace to even talk about this issue. I mean,
Might as well talk to them about their pension.
Right. They're just going to say, oh, I don't want to have kids, or I'll adopt, you know, like, and it does bother me. Like Dr. Metzger is saying, yeah, I mean, I do recognize that they're not really capable of giving informed consent.
Mm-hmm.
But he says, we have to keep the kids happy in the moment.
Mm-hmm.
You know, like it's always a good theory that you talk about fertility preservation with a 14-year-old, but I know I'm talking to a blank wall. And the same would happen for a cisgender kid, right? They'd be like, ew, kids, babies, gross. Or the usual stock answer is, I'm going to adopt. I'm just going to adopt. And then you ask them, well, what does that involve? Like, how much does it cost? Oh, I thought you just like went to the orphanage and they gave you a baby. No, it's not quite like that. And I was just trying to find it, but I can't quickly locate it because all I have is like a picture of a slide. But apparently last week at the Pediatric Endocrine Society, some of the Dutch researchers gave some data about young adults who had transitioned and reproductive regret. And it's there. And I don't think any of that surprises us. I don't remember any of the numbers or anything. I have a picture of a slide, but hopefully this is something that'll get published in the next while. But, you know, I think now that I follow a lot of kids into their mid-20s, I'm always like, oh, the dog isn't doing it for you, right? Yeah, they're like, no, I just found this, you know, wonderful partner and now we're kids and da-da-da. So I think, you know, it doesn't surprise me, but I don't know still what to do for the 14-year-olds. The parents have it on their minds, but the 14-year-olds, it's like talking with diabetic complications with a 14-year-old. They don't care. They're not going to die. They're going to live forever, right? So I think when we're doing informed consent, I know that that's still a big lacuna of that we do it, we try to talk about it, but most of the kids are nowhere in any kind of a brain space to really, really, really talk about it in a serious way. That's always bothered me, but you know, we still want the kids to be happier in the moment, right?
Wow. It's absolutely incredible because, I mean, you know, I would be very happy in the moment, maybe taking OxyContin, but my doctor is not going to give it to me, right? That would be a short-term solution to, you know, having a bad day. Take some OxyContin, give it a try. It'll be fine. It's mind blowing.
All of us, yeah.
Wow.
It is mind blowing and shocking, considering that doctors take an oath to do no harm, and these doctors. You know, and this is only one topic, the topic of sterilization and sexual dysfunction. Mm-hmm. There's all sorts of discussions on there about, you know, developing tumors as a result of estrogen treatment, liver cancer as a result of estrogen. Mm-hmm. One of the clinicians there posts the fact that he or she knows somebody that was on estrogen for many years and developed liver cancer as a result. And then, you know, they're discussing, you know, many other issues, and they're completely aware that the evidence behind it is so poor, and that it's flawed, and that it's low quality. And yet they are going ahead with it. And they're saying, we all have to agree. We all have to be on the same page. We all have to present ourselves as, you know, in agreement on all these issues, because they're saying, you know, the extreme right is pushing back on gender affirming care. And so, you know, with legislation and other things. And so we have to, you know, give an appearance of all being on the same page on these issues.
Yeah. I think what also kind of really struck me about these WPATH files, and also WPATH as well as an organization, is how much they kind of ran themselves like the Stasi, or, you know, there was like an intense fear running through this of, you must not speak in public and you must not kind of deviate as what you must not voice criticism in public as an MD about the feelings that you have. Keep it to yourself, because you don't want to derail the movement, or you don't want to harm children, right? There's a lot of very emotionally manipulative ways in which they try to really silence you. It's like, yes, you're right that some kids are going to be sterilized needlessly, but you wouldn't want to cause suicide, or, you know, it's always something manipulative like that. So one thing, so let's just get into the files here, because they're so explosive, right? So one of the first things that comes out to my mind really is from Dr. Metzger. And quote, "We're explaining things to people who haven't even had a biology in high school." Right. That was one of the first things that came out to me, jumping out to me from this. So I think that Dan Metzger is Dr. Metzger is really trying to ethically raise concerns, right, to his colleagues. So I really, you know, want to give him a lot of credit for that. So he is kind of acknowledging this, and then he is saying, quote, "The 14-year-olds, it's like they're talking about diabetic complications with a 14-year-old. They don't care. They're not going to die. They're going to live forever," right? So I think when we're doing informed consent, it's still a big lacuna, quote, end quote. This is an amazing thing for Dr. Metzger to kind of be saying here.
You know, Alex, I would agree with you that we do have to give some credit to him for voicing his, you know, this ethical dilemma that he is struggling with, and, you know, presenting it to his colleagues. So, you know, in that sense, yes, sure. I do give him credit for that. Sure. Now, I want to point out that when Dr. Metzger is talking about diabetic complications and he's mentioning a 14-year-old, it's because as an endocrinologist, he most likely does have patients who are 14 and have diabetes. And so he has the experience of sitting down with a 14-year-old diabetic and trying to, you know, explain, well, look, your diet is, you know, you could die. I mean, if you have too much sugar, if your blood sugar goes too high or too low, you could go into a coma, you can die. And he's comparing that to, you know, the difficulty in getting through to a young person about that topic. He's comparing it to the difficulty getting through to, a gender distressed kid and talking about the complications of puberty blockers and cross-sex hormones. The difference is, Alex, that a diabetic has a medical illness. Right. A diabetic needs to go on to insulin in order to be treated for this medical illness. We have, you know, we have more than enough data that shows us that insulin saves lives. But the kid who has gender dysphoria, we don't have data showing that blocking puberty and cross-sex hormones is going to save their life. To the contrary, we don't have that data. So, you know, he's lumping them together. They should not be lumped together because it is not life-saving. To the contrary, it is harming the child. It is not allowing the child to go through the puberty that kid needs in order to hopefully outgrow their gender dysphoria. We know that kids can outgrow their gender dysphoria. They need to go through the process called puberty, in which there's a massive, you know, maturation of the entire body, including the brain. The brain matures. The child gets older. And in most cases, at least the research that we have on, you know, the Jazz Jennings type of gender dysphoria, which is a different group, okay, I'll admit it's a different group than today's epidemic, but still, we know that kids can outgrow it. We just need to give them psychotherapy, give the family support, and let them reach adulthood. So, yeah, that's the point that I wanted to make. But what you're saying about Dr. Metzger is just so chilling.
Yeah. Oh, completely. And I also just wanted to kind of expand on this thing of the religious right, or the so-called religious right, or whatever it is, right? I think that really the WPATH files have proven themselves to be simply a medical scandal that hopefully one day they will create a Netflix show about, the same way that they've created Netflix shows about the opioid crisis and it's exactly, completely and utterly the same. And I think that that's a very convenient kind of label to stick on everybody. Just so, I mean, I'm sure my audience probably knows this, but the first person to write a book critical of transgenderism was a feminist in 1979. She wrote The Transsexual Empire: The Making of the She-Male. She was as far as of the religious right that you can possibly ever be, and she was the first person who really coined a lot of these terms that we see kind of being used today. And I remember, well, of course I don't remember, but people have told me the reaction she got when she said there will be child sex clinics in the future. They basically laughed at her. They said, Janice Raymond is a nutcase. Listen to this. She's saying there's going to be child gender clinics, and listen, well, she's still alive to see it. I don't know if that's a good thing or a bad thing. So something else I wanted to kind of talk a little bit about here was sort of point two from the WPATH files. So what we have here is somebody writing an email saying that they've been thinking what it looks like to fully obtain informed consent. And that what that actually means, and can these children actually consent to things like, loss of sensation? Can they consent to, is it even possible, right? Let's say these treatments worked. Let's say 100% of the treatments worked, were successful. And, these kids went on to be happy, sex changed people. We know that's nonsense, but let's imagine for a moment that that's the case. Even then, this is the point number two is raising here, is that really, even then, you really can't obtain informed consent about things like loss of sensation from somebody that's that young. So it's completely irrelevant. We shouldn't be doing this at all. Really doesn't matter. Does it work? Does it not work? Is that kind of what I'm hearing from that one?
Oh, yes, of course. And you didn't mention giving a minor giving consent to having her breasts removed, and the consequences of that, which are so massive. And we know that these bilateral mastectomies are being done on girls as young as 13 years old in the U.S.
I just wanted to piggyback on all of the importance that comes up with the informed consent. But what really disturbs me is when the parents can't tell me what they need to know about a medical intervention that apparently they signed off for. And so I think informed consent has to happen very differently for parents than it has to happen for children and early adolescents and adolescents. But it needs to happen. Then you kind of have to listen to what the youth is doing with that information to kind of not catch them, but to pick up on the ways that they're not really understanding because they'll say they understand, but then they'll say something else that makes you think, oh, they didn't really understand that they are going to have facial hair, right? Because they say something else that makes you think, oh, they didn't get that point. But they'll say they totally get it. The pediatric endocrinologist came out and said, yeah, they totally get it, on board. I don't have any concerns about their understanding. I would go in and I would say, okay, so tell me what you learned from, and they'd just be like, we have no idea what they were talking about. And so I think the more we can normalize that it is okay to not get this right away, it is okay to have questions, the more we're going to actually do a real informed consent process. than what I think has been currently happening, and that I think is, frankly, not what we need to be doing ethically.
I write at length about this. I have a chapter in my book called Euphemisms, because the proponents of this ideology call bilateral mastectomies top surgery and genital surgery, in which the penis is amputated and, well, I don't have to, all the gruesome details.
The gruesome details.
They call that bottom surgery. And why do they make up these kind of, these kind of happy, flippant.
Feels like marketing terms. I mean,
top surgery, bottom surgery, it doesn't sound like a big deal.
No.
Well, it is a, horrific thing to remove the breasts of a girl who is mentally ill in nearly every case, I would say. Yeah, in every case, because a girl who is so loathes, so hates her body, that she wants to climb on an operating table and have her healthy breast removed, does have a mental illness, Alex. And so to do that to her, and, and some of these young women a few years later are waking up to the realization of what they did to themselves. And, it is so difficult to listen to them and to see them, the detransitioners. Are you aware of a detransitioner by the name of Daisy Strongen?
Yes, I am. Yes.
Oh my goodness. Maybe you can put this up. It would be important. She had her second child recently. Daisy is a woman who lived as a man for 5 years. She took testosterone and had her breasts removed. Then she realized that she deeply regretted her choices. She went back to her life as a woman. She got married, and now she's just had her second child. And she posted on X, Alex, the most, I don't know, I can't even describe it. She's in the hospital, she has the IV in her arm. She's just given birth. And she's holding her infant, her baby daughter, and giving her a bottle. And Daisy's face is just, she's contorted in grief. Her face is contorted in grief. And she explains in her post on X that she's overjoyed about giving birth and having a daughter, but she is grieving her inability to nurse her daughter.
Yes,
and so, we see here that you cannot get informed consent. I would argue not only from a minor, but I would argue from a young adult who, is still maturing and still growing up. You cannot get informed consent about what it means to have your breast removed and to lose the ability, to have that. There's the sexual satisfaction there, arousal. There's nursing. There's maternal child bonding that occurs through nursing, and all those things. So I write about that in the book, and I am urging people to instill in their daughters a sense of awe for their biology, for how their bodies work, including breasts and nursing. And that simply, doesn't have any part in modern sexuality education.
Yeah.
In sexuality education, I know I'm getting off on another subject here, but it is relevant. Girls are basically taught, that they're essentially the same as boys. I mean, there's a few things that may be different, but they're like boys. Instead of highlighting the awesomeness of our unique biology. And you and I were both mothers. You know what I'm talking about. And so-called gender affirming care is robbing young women of that, stealing that experience of motherhood and nursing, which is so fulfilling. Many women say that is the most fulfilling part of their entire lives.
Yeah.
Giving birth, becoming a mother, nursing their child if they're able to.
Yeah. You know, and Miriam, that really interestingly takes me on to the next point here, because this one was extremely difficult for me to even read, to tell you the truth. And that is Christine McGinn's point. About how, expressing, saying that I have performed 20 vaginoplasties in patients under 18 over the past 17 years. And, sort of talking about battling the hospital for the ability to be able to continue to do this. So just so we're understanding what we're talking about here, that is the cutting off of the penis. I mean, that's a very crude way of describing it, but essentially, yes, that is what it does. In fact, it's slightly more unpleasant than that. And doing that to somebody who is under 18 years old, and she's talking about, really wanting to be able to do that, and then makes a suggestion to her WPATH colleagues. And that suggestion is, I think the best time for surgery in the US is the summer between your last year of high school. That's a quote. That took my breath away, Miriam. It really did.
Yeah. A lot of these things are just so deeply shocking, and I do look very much forward to more and more of this being exposed. But I want to, of course you're right. The vaginoplasty, which is the surgical creation of what they call a vagina. Of course, it's not a vagina. And it, leads to horrific medical complications. I go into it in my book. We probably don't want to discuss all of those right here. I'm afraid we'll lose your audience, because the consequences and the complications of this surgery are just so disturbing. And I have a patient who had a vaginoplasty, and so I know firsthand what people go through, what these men go through, and their regret and their sense of betrayal by the medical profession, because there simply is no solid evidence that over time these individuals are going to do well. Are there individual anecdotal cases of people that had these extreme surgeries and are happy and fulfilled and pleased with their lives? Yes, I'm not going to deny that there are some. But when you look at the studies and at the data, we don't have data that shows that those people are in the majority. And perhaps more importantly, we cannot predict ahead of time which people are going to do well and which are going to do poorly and have a whole slew of medical issues, chronic pain, infection, inability to urinate, inability to have any sort of sexual activity due to pain and due to embarrassment. We know the data that we have, the long-term data, is that these people are not doing well. And so when they're suggesting that the operation be done, I think they're saying the summer before their senior year, right? Because they're arguing that to do it the summer before college is too risky. They're going to need, a lot of support and a lot of recovery time after the surgery. So I believe what they're suggesting there is to go to college after the summer in which this surgery takes place is not a good idea. So they're suggesting the summer before their senior year. And they're even younger, obviously. They're 17 at that time.
But it's absolutely incredible that everything we said was happening really was happening. That people were saying, no, nobody's going to get a vaginoplasty when they're 17 or 16, and this doctor just is kind of freely admitting it. And I think that and I think it's really important also that they're speaking. They also speak quite a lot about the ability to be able to orgasm in patients that are given testosterone who are female, and that they're unaware if they're able to, or if they are. They seem to really have no specific answer on this, and I think that that's in just absolutely incredible that. Because it flies in the face of really everything they've been saying as an organization for the past kind of like 20 years, which is like, no, there's no loss of sexual function. That's all anecdotal, or, we don't know. And here they're saying in the files, they know.
Well, Marcy Bowers, who is the current president, right, of WPATH,
Mm-hmm.
Dr. Marcy Bowers, she's either the current or past. I think she's the current president. He.
Mm-hmm.
You see,
That's
now we get into a whole pronoun issue. So
right.
Dr. Marcy Bowers, of course, a transgender individual. So Dr. Bowers did announce on Dr. Bowers was doing some sort of educational video for WPATH professionals. And Dr. Bowers did state there very, very clearly that when boys are, as suggested, given puberty blockers at the very start of puberty, and then they go on and take estrogen, that they basically will not be able to orgasm. And why is that? That's because their whole, their genitals, the reproductive system is frozen in time. It's frozen in that phase of pre-puberty, where boys, have a micro penis. They don't have the capacity to ejaculate. They don't have. Well, you could argue that. I mean, there are people that would argue they have some sort of sexual response, but it's not an adult sexual response. Let's put it that way.
Mm-hmm.
And so these interventions are going to freeze the boy at that state. And also super important is that with such a micro penis, the boy is not going to have enough tissue. You see, what they do in a vaginoplasty is they take the tissue, the skin of the penis, and they use that to create what they call female genitalia, which is quite a feat. But sometimes more successful than other. I mean, never successful, because you cannot create. No surgeon can create a bona fide vagina, a bona fide clitoris.
Mm-hmm.
But what I'm saying is that when the boy is very young and his genitalia are frozen in time, the surgeon is not going to have enough penile tissue to go ahead and perform that vaginoplasty. And so what they have to do, and this is what was done with Jazz, and I know that you're aware of that, but Jazz had a very small penis. And so Dr. Bowers, who was doing the surgery, had to borrow tissue from Jazz's colon. So this becomes a complicated surgery. I mean, it's already very complicated, but to have to remove tissue from the colon, and then then that colonic tissue becomes part of the new so-called vagina.
Mm-hmm.
I mean, there's all sorts of complications here.
As we saw with Jazz, I mean, the worst thing that really could have happened to this, to WPATH and to Marcy Bowers, I think professionally, was that you brought cameras in. I mean, Jazz was a huge experiment, and I think the arrogance of that to assume that it's all going to go great. I mean, Jazz's Jazz's surgery was a failure on a medical level. On a sociological level, it was a failure because look how miserable Jazz sadly is, and also psychological. On every level, this was a massive failure. You know, Jazz is emotionally is just in pieces. And I think that was a big mistake. If that was me, I would not have invited TLC in to watch the freak show.
You know, yeah, those parts of the series of I Am Jazz will no doubt make their way into that Netflix documentary about this medical catastrophe.
Or a huge lawsuit. I mean, that's the other one.
Well, yeah, I mean, look, I have to say straight off, since I am a psychiatrist, I have never met Jazz.
Yeah.
I have never talked to Jazz. Okay, so, but I can say that having watched very closely that entire series on TLC, that it's incredible that they had, that they filmed the operation in which the two surgeons were actually arguing about what to do. And, you know, Dr. Bowers and Dr. Ting, I think was his name, the other surgeon. And, you know, they were arguing about what should be done next and what was scar tissue and what was not scar tissue, which what that does is it demonstrates how this is, you know, a one of a kind, you know, a very unusual experimental surgery. And as I explain in my book, Alex, you know, when a person, God forbid, has to go for surgery, what you want is to find a surgeon who has done this surgery
a million times. Yeah.
You don't want your surgery in the your surgeon saying, well, gosh, what should we do now? You know, look at what's happened here. What are we supposed to do now? And then the surgeons are not in agreement about what should be done. So, I mean, my goodness. And then they're going, and organizations like WPATH, which are, I didn't say this earlier, Alex, this is important. WPATH is, you know, their so-called standards of care for transgender individuals are held up as the gold standard all over the world. They are held up as the best practice by doctors, hospitals, clinics, therapists, and courts.
Courts, yeah.
Lawyers who have cases in court on these issues will point to WPATH and say, well, this is what WPATH says standard of care. Okay, so WPATH,
like for the World Liver Association or something, you know, I mean, it's something like that.
And so what the reality is that these are experimental surgeries, especially on minors, especially on kids such as poor Jazz, who was only, I think, I don't know if 16, but whatever age, the point was that this child was given blockers to prevent puberty, which under other circumstances may have allowed Jazz to outgrow the intense loathing and disembodiment. If Jazz had proper medical and psychiatric intervention, which was not the case. Jazz is the poster child for gender affirming care, in which apparently there was nobody that, you know, very carefully sat down with him and said, you know, what is this about? Let's look at where this might be coming from. You know that you will, as much as you want, Jazz, as much as you're dreaming of it, you can never be a girl and you can never be a woman.
Yeah, Marion, that's such an excellent point about Jazz, and I think that I feel extremely sorry for Jazz, and that's one of the reasons that it's even very difficult to talk about Jazz, because Jazz is a real person, and sometimes it can feel that we're talking about him to try and be mean to him or something, and he's been exploited to so much already. I mean, he's been exploited by TLC, he's been exploited by every 2-bit gossip magazine for clout, he's been exploited by every crappy transgender health organization. I mean, it's just horrendous. And then for us to kind of, it feels like we're sticking the final knife in. And I just want to say, like, we're not, absolutely. We're not trying to stick the final knife into Jazz.
I think that, no, not at all. Of course not. We only want the best. My goodness.
Mm-hmm.
What happened over there is I think the entire family just became so indoctrinated by this idea of being born in the wrong body, and they were just 100% certain. Because remember, Jazz is not an ROGD kid, a rapid onset gender dysphoria kid. Jazz, from the age of 2 or 3, 4 years old, was announcing that he was a girl. Mm-hmm. So it's not something that he picked up from his, from the internet culture, or from school. Mm-hmm. This was something that was going on internally with him, and he was a classic case of gender identity disorder. And the studies that we have of those kids show that the great majority, if they are permitted to go through puberty, like I said earlier, will outgrow it. Many of these kids are gay or lesbian, mm-hmm. but they do outgrow the discomfort with their bodies, and they can continue on to be healthy and whole and have children.
Just absolutely horrendous. And really, really do hope all the best for Jazz. Now, sadly, there was another couple of messages that were on WPATH's internal board. One, a patient became dangerous, which ultimately led to a restraining order. And they kind of go on to say that they're concerned that this could have really been related to their treatment. And actually, I know that there also was a very, very, very similar story in a hospital in Haifa, which actually they ended up closing that hospital and changing the process entirely. So it's not the first time I'm hearing of something like this, but is shocking nonetheless. That you have, you're continuing treating a patient that you're fearing, that you're saying is dangerous, essentially.
Well, what struck me about that particular story there from the WPATH files was that the clinicians did not seem, and maybe it was just an excerpt and there was more, okay, but I didn't see discussion of, whoa, we really have to make sure that we get a solid psychiatric evaluation, and we're sure that this patient that we're going to be operating on is stable, is psychiatrically stable. But you see, Alex, then we go back to that would be gatekeeping. Mm-hmm. And now I also want to point out that this patient, I don't know if they said if it was a man or a woman, but being placed on, ultra high levels of testosterone or estrogen, levels that a healthy person, a boy or girl, man or woman, would never, ever be exposed to. I mean, they're putting girls on levels of estrogen that, are so far beyond what their body would ever be exposed to unless they had some sort of a tumor. And so we have to, it's no surprise. Are you kidding me? Testosterone?
Right.
Testosterone, these are steroids that we're talking about. They have a black box warning, and estrogen also. They're going to have very significant impacts on mood, on mood stability, on perhaps, aggression. Right. I mean, testosterone is Is there anybody that doesn't know the
Right,
association?
the effects of testosterone. Yeah, it's pretty incredible. It's pretty incredible. And just kind of moving on from the testosterone, one of the other really incredible revelations was that there was another patient who, after 8 to 10 years of testosterone, died. And they wrote on the message board, "To the best of my knowledge, it was linked to their hormone treatment." I mean, all of these are just incredible revelations, because obviously we understand that you shouldn't. I can only imagine what a woman would feel like to be sort of all of a sudden just awash with testosterone, because it's so powerful. I mean, isn't that why you're not allowed to be like to take, for example, testosterone in the Olympics? I mean, because it like greatly affects everything about you.
Of course. But you see, what they've done in this again, it's this Orwellian way of thinking. They are saying, what we're doing, we're helping these people by bringing their bodies in alignment with their minds. Okay, so again, look, Alex, all of this, I really think this is like one of the final nails in the coffin of WPATH and in the coffin of gender affirming care. There's just the evidence against it is so formidable, Alex. And every few days, it seems, there's another study, there's something, there's another whistleblower, and we're getting to the tipping point.
Yeah, I know, but one of the, I totally agree. But in order to get past that, I think more people have to know about what happened here and the level of the scandal, so that hopefully we can learn about it. Because my feeling is that this is lobotomy 2.0. And I don't know what will be lobotomy 3.0, and hopefully we can kind of learn from it. One of the things that struck me so much about the WPATH files is this idea that one should not speak publicly about anything that's concerning you. Like if an individual patient feels they've made a mistake, be careful with that, not letting that change the way others receive care. So, you mustn't talk about detransitioners. You mustn't talk about, feelings that you have, questions that you have, because you may become one of those people who will stand in the way of people receiving care and ultimately preventing suicide, which is, it's one of the most manipulative. It's actually incredible that it would work on a pack of doctors. But it definitely seems to. And tell us a little bit more about what you know about suicide, especially with what recently came out.
Sure. Well, I think the bottom line is that we are seeing that to this organization, WPATH, and to the proponents of gender affirming care, they simply don't value the truth. What they value is their particular agenda, which is transitioning at any cost, normalizing the whole thing of individuals who are so have such a disconnect between the mind and the body, normalizing that, and being, and not tolerating any dissent whatsoever. So it's really it's a tyranny. It is not tolerating any dissent. It's a political organization. And that's really, we have the final word on that. There is no defense, in my opinion. So to speak about suicide, why so many people ask, why do the parents go along with it? Why do they sign on the dotted line? Well, I can tell you that many parents have been led to believe that if they don't, they are putting their child at risk for suicide. And the number of parents that I've had here in my office who I don't know if I mentioned that my private practice is devoted to these families, helping these families. So the numbers, I've had great numbers of families who have told me that they did go to a gender therapist who warned them and threatened them actually that if you do not get with this program, if you do not go with the new name and pronouns and putting your child on blockers if that's what they want, then your child may commit suicide.
Mm-hmm.
So it's a affirmation or death, affirmation or suicide, kind of a mantra that is said over and over and over again. And it simply is not true. And parents are waking up to that fact. More and more parents are recognizing that the data that they have is not based on actual, high quality studies. They're based on, for example, the Trevor Project will have an online survey of kids, and they'll ask, have you ever considered suicide? Have you ever thought about suicide? Well, and then they get a large majority of kids saying that they have. That is not a high quality study. That's a study that's rife with bias and lack of clarity about the question. I mean, many people will have instances of, especially teenagers, will have momentary thoughts of, I wish I were dead. Mm-hmm. I wish that, I'd go to sleep and never wake up the next morning. That's not a serious suicidal ideation. Mm-hmm. And they will lump this together with with all sorts of categories. And they'll say, look, transgender kids are suicidal. They commit suicide at a much higher rate as non-transgender kids. Now, what I wanted to mention is that a study came out recently out of Finland. This is a very important study that looked at suicide in over 2,000 kids under the age of 23, so teenagers and young adults, over 25 years, from 1996 to 2019. And they looked at these kids, over 2,000 of them, who were referred to gender clinics. And what they discovered is that suicide in these kids was a very, very unusual event. And that there was no evidence of increased suicide in those kids that were attending gender clinics compared to the general population.
So it's all just nonsense. So all of this life-saving care, this is life-saving care, suicide. From what you're saying from the Finland study, it's all total nonsense.
Well, what the study did demonstrate is that there was an association of suicide in those kids who had coexisting mental health issues. This is what we've all been saying for such a long time. It's the coexisting anxiety, depression, cutting behaviors, being on the autism spectrum, having a history of trauma. Those are the things that are associated with suicide in these kids, not their gender distress.
Wow. It's incredible. It's just built on a house of cards, Miriam. And, because you're a psychiatrist, I really would love to get your opinion on this, because I've always had sort of suspicions. But when I was always kind of the opinion that one should never really discuss suicide, because for example, when suicide is reported in the media, there tends to be increased levels of suicide. And, for example, when Kurt Cobain committed suicide and Marilyn Monroe committed suicide, that often speaking about suicide can be a very unhelpful thing for a culture. And what do you think it does to these children to constantly hear this idea that they might end their lives this way? Surely that's just making them consider it, make it, make them think it's an option for them.
Yeah. Well, Alex, I'm sure, let's put it out there just so that we're clear on this. Every suicide is a horrible, horrible tragedy. And any individual of any age that talks about wishing they weren't around, wishing that they wouldn't wake up in the morning, think that, sharing the fact that they're having these thoughts, that needs to be taken very seriously. And that person needs to, as soon as possible, be evaluated by a mental health professional. So that should be something that's clear.
Yeah.
Now, at your point that, to tell these kids as they over and over and over again, that if you are struggling with your gender identity, you're at risk of suicide if the people around you don't honor your new name and your new pronouns, and if you don't get these medical treatments, you're at risk of suicide. Now, this is simply, there's no foundation to it, but even if there was some foundation to it, you don't, like you said, you don't put it in front of a person that, oh my gosh, people who have this disorder that you have are at risk of suicide. You know that, right? You know that. And that if you don't get this intervention, you're at high risk of suicide, right? And if your parents are not going to sign on the dotted line, well, then they're toxic and they're dangerous, and your home is dangerous. I mean, this is, in my opinion, malpractice, malfeasance, because kids need their parents at this time when they're in a crisis. And again, we have no evidence that these kids are at increased risk of suicide. And we certainly have no evidence that if they get so-called affirming care, they're at any decreased risk of suicide. In fact, they may be at increased risk if they do get the so-called affirming care.
It's just incredible, Miriam. And we're so lucky. I know that we're also lucky as at Partners for Ethical Care, and just in general, the wider movement, to have someone like you, an expert like you on our side, who sees things so clearly with so many fantastic years of experience. Not only are you a child psychiatrist, you're also, of course, all psychiatrists are MDs, but you also have that sort of scientific background that you talk about all the time in your books about the importance of hormones and the importance of hormones when it comes to sexual development, and I've so appreciated all of your books on this, and I'm just so thankful that we have someone like you speaking and helping us to decipher these things.
Thank you. So before we finish, thank you very much, Alex. I just want to tell your audience that my book, Lost in Trans Nation, it is written for regular moms and dads. It's not written for PhDs and doctors. It's readable. It's, a normal book for parents. And it also has tons of concrete guidance and advice on how to inoculate your family before you might be hit with this atom bomb of one of your kids coming home and suddenly announcing that they're the opposite sex. How you need to get control of your kids' internet use. You must get control of your child's internet use and be aware of who they're talking to online. There's predators online that are looking for your child and want to influence them in this direction of harm. How you have to understand what's happening in schools. And the other thing I want to say is that part of my book involved doing a survey of parents who have experienced or who are now experiencing this in their homes. And I asked them, what advice would you give parents who have yet to see this happen or are going through it right now? What would your advice be in advance? In other words, what do you wish that you were told before this nuclear bomb hit your family? And so I include a lot of their advice. I got responses from 500 parents in 17 different countries. that offered incredibly just spot on, excellent advice for parents. So that's also a part of my book.
Yeah.
And just one last thing for people who cannot get the book, people who can't get through a 300-page book, which I well understand. I did the narration. There's an audio book. I did the narration, and they can listen to it while they're driving, while they're doing the dishes, what have you. And Alex, thank you so much for all that you do. Thank you for your great work, your website, your podcast. You've really been at the forefront of this for a long time, and I thank you.
Just following in your footsteps, Miriam, the WPATH files are one of the greatest medical scandals of the last 50 years. And I know that we're going to have a lot more information on that. And if you want to hear more, please go to our website at partnersforethicalcare.com. Or if you're a detransitioner and you're looking to seek a lawyer, please go to Transition Justice. You can follow us, of course, on our social media. And if you have any questions or concerns, please write them in the comments. Please share this interview widely and give us some feedback on it. This is, of course, a series that we're going to be continuing to create with a lot more guests. And we're incredibly excited to be on this journey, hopefully out of gender with you. Thanks very much, and we'll see you in the next episode.